Hello, everyone. Have about 1,000 people here and coming in from all over the country and all over the world. And I am in Santa Rosa, California. It's kind of a cloudy, rainy day. Last week it was very sunny, and we are broadcasting live from Dr. McDougall's home. I just wanted to assure you that this is live. Some of you were wondering if it was recorded. No, this is live. And today is what day is today? Today
It's Thursday.
Today's Thursday.
Probably the date is
You see,
16th of June.
16th of June. Yes, and it's 11 a.m. in Pacific time. So we're here live. And I just wanted to remind you all that next week we have Dr. Lyle as a guest speaker, and he is just an amazing person to listen to. So make sure you go to Dr. McDougall's website and sign up for next week and bring your questions. And if you saw last week's webinar, now you will understand why I'm going to say, Hail the King. Welcome to McDougall Kingdom. And like many of you have said, and welcome, Dr. McDougall, King McDougall.
Yeah, King McDougall. As I say, if I ever got that designation, you'd have to have bodyguards 16 thick, because they'd kill me within 24 hours.
Yes, that's right. I've been saying hello to Mary.
You want to come in and say hi, Mary?
Come in and say hello. People love to see you. Just say, we are live. Here's Mary.
Hi, everyone.
Good, thank you.
Great. I was expecting you to be in the other room.
Getting ready for the trip to
Yes,
Alaska.
yes.
All right.
Oh, yeah. Good. Well, yeah. Poor, she's very stressed, very worried.
It's a lot of organizing.
Yeah.
Quite a lot of people are joining you there, right?
Yeah, I think we have 62 people, and then we also have the grandkids, which is the reason we're going.
Oh,
It's because Heather wanted to show the grandkids Alaska, but we've got the National Geographic ship, so we're taking 62 people.
oh.
And also the grandkids. That's where we're going,
Right.
for the grandkids, but also a lot of.
Well, they're older now, so they will really enjoy that.
Yeah, they are 8, almost 10, and almost 13. So
Right.
they are, and of course, then we have. Mary and I were talking about that. We have younger grandkids who are way too young to go on a trip like this.
Right.
So someday maybe we'll be healthy enough and strong enough to take the younger grandkids. We have
Oh,
4
yeah.
others that need to go. on
4
these trips.
others. Wow.
But anyway, and I just want to mention, Mary's talking about putting a trip together to down the southern coast of Costa Rica, and also through the Panama Canal, and that'll probably take place in 2017. The Alaska trip sold out in 48 hours. So if you have any interest, it's going to be an expensive trip. But if you have any interest in going, start thinking about it now. And as soon as it's announced, I wouldn't wait to sign up, because it will be sold out. If we still hold any popularity, it'll be sold out in just a few hours. And we still have some room for Kauai.
For Kauai, yes.
But that's sold out 3 times already.
That's already sold out.
3 times.
3 times.
And Mary begged, and she got more room. So there are a few more rooms left.
Well,
We're doing that. But anyway, I wanted to talk to you about a few things before we started going on our discussion.
let me just quickly tell people, I do get your questions. I have a few pages, and if Dr. McDougall wants to talk first about a few topics, we'll get to some questions. I never get through all of them, but I keep them eventually.
Yeah,
yes.
eventually. We're going to keep doing this every Thursday for
as long
a decade.
as we can do it.
I just wanted to bring you up to date on the the thing that's caused most attention, and that is my picture in the last newsletter with a tattoo on my chest. Do not, Kath, I will sue. And I've been. It's gotten a lot of attention. I'm glad about that. And again, people who read that newsletter, you were concerned about me, and I appreciate that. But I'm back to 100% health. So that was a difficult year, but I'm back. But you missed, a lot of people, I do want to remind you, you missed the point of the newsletter. I wanted to point out to you that more than half of you have significant lesions in your heart that are old scars. More than half of you do. And if somebody goes looking, they're going to find them, but they're old scars. and then they're going to operate on you. They're going to put stents in you. As I mentioned in the article, I want you to go back and review that May 2016 newsletter. I want you to review it. I want you to see that half the people who go to the hospital for non-cardiac problems are recommended to have prophylactic revascularization. In other words, the cardiologist comes in and sticks stents in your heart. I'm not saying for no reason at all. I mean, the biggest buildings in your towns are hospitals, and 80% of their income comes from cardiac surgery. So there are reasons to do this, but not in your best interest. And I want you to spend more and more time with that May 2016 newsletter. I didn't reveal myself, my personal self, to you for no reason at all. There's no gratification in it for me. I want to explain to you what's going on. And I've considered things as drastic as well. I've contacted some higher up people in this business and told them that I'm mad as hell. And, I've even considered things such as legislation and legal action. But I've done that before, and it's gone no place. I've done that with breast cancer treatments, and I've done that with medical education for students. And if you go back and read that newsletter, any of you who have been wronged or you have a ton of money to fight big business, I set it up for you. So just go for it. I think it's well worth the trouble.
You have put some hyperlinks there.
Oh, all the research is there.
Remember to click on those. You get to see the research there. That's very important.
It's all there, and it's totally consistent. And people who represent this kind of malpractice of doing revascularizations, of doing these stents on healthy people on chronic coronary artery disease, which is what you all have. People who recommend that are defenseless. They have nothing to say except we do it. We have Mercedes and Teslas, and we do it. We make a good living, and we can sure fool you. Mm-hmm. Well, if you're tired of being fooled, all of the research is there. All right, let's get on to another subject before I go on, and that is there's a great article that it's about ready to be published, or it was published May 10th, 2016 in The Lancet. It's titled Salt Too Much or Too Little. And I don't know whether you can get this or not just by the internet. It may be copyrighted, but it talks about a discussion that I've had with many people, including Jeff Novick, our dietitian, for 20, 30 years. We've been talking about this, as whether or not salt is the problem. I consider salt the scapegoat, by and large. There, of course, are some qualifications I'll give you on that. Salt is the scapegoat. When it comes to bacon, it's the pig, not the salt. So it's the company that salt keeps that makes you sick. I mean, the reason you can eat cheese is because it's loaded with salt. The reason you love salami is because it's loaded with salt. You wouldn't eat the basic dead animal food yourself. You couldn't stand it unless they put the salt in it. So when they're talking about salt, 70% of the salt that you eat comes in your prepared foods. That's the problem. The culprit is the company that the salt keeps. Anyway, there's some good argument, and it's really coming to a head as to whether salt is a necessary ingredient. Certainly, we know it is a necessary ingredient for enjoying food.
Definitely. I have experience in that.
Yeah, I don't know whether we want to talk about your experience, but it's always been on a very low salt diet for a few days, and realizes how much we miss it. Salt is a taste bud on the tip of the tongue. We're designed as salt seekers. And I believe if we go on a very, very low salt diet, with exceptions, you're stressing the system. You're making it overwork, the adrenal glands overwork. And on the data, and it reviews the data in this particular article from The Lancet, May 20th, 2016, Salt Too Much, Too Little. It reviews the data that says, it gives you both arguments, but it also clearly shows that in many, many important studies, you're built to be a salt seeker, to eat salt. Certainly you don't like the food without salt. I mean, that's what you're missing. So that's why we recommend you put salt on the surface of the food so that you like the food, mainly. You gotta eat the food. And also, I believe that for the general healthy person, it is important to eat salt. The taste buds wouldn't be there if it wasn't important to eat some salt. Now, I can give you some exceptions. Some people with very severe hypertension, the Kempner diet, which I recommend, is extremely low sodium. And in this article, I believe they say people with a high blood pressure who have salt intakes over 7 grams are benefited with a low salt diet. So do realize that they're taking you off point when they focus on the salt. The problem is the cheese and the bacon and the salami. That's the problem when they blame salt. And if you enjoy salt, there's a reason for it. It makes anything taste good.
Right.
So anyway, get that point across. The McDougall diet is not deprivation. It's we use a little bit of salt and a little bit of sugar on the surface of the food. Don't misunderstand. It's a starch-based diet with whole foods. You must flavor it so that it really tastes good, and that means salt, sugar, and spice. Put it on the surface of the food so you get maximum taste with minimum impact that might be slightly negative. All right. Well, I want to go on to one other subject, and we'll go to questions, and that is something that just came out just a couple of days ago.
Right.
It was June 15. So that was yesterday. It was June 15. It came out, and it follows some things that we've talked about before. In my August 2010 newsletter, I told you colonoscopy should not be the gold standard, and that it causes more harm than good in terms of the screening technique. And I solidly said that to you in August of 2010 in the newsletter and some follow-up newsletters too. Then we talked about, maybe it was 2 or 3 months ago, about how Canada, the Canadian Preventative Task Force, now recommends against colonoscopy for screening. Okay. And now the U.S. Preventative Services Task Force has come out with their statement. They just came out with it yesterday on colorectal cancer screening. They strongly recommend that people be screened between the ages 50 and 75 years old. A strong recommendation. But then they also talk about 7 ways to do it. And these ways are stool for blood. You just check a bit of your stool for blood. They also have a fecal immunochemical test, and I believe that's for blood also. And then they have a DNA test called Cologuard. And then they have endoscopy tests like sigmoid and colonoscopy. And their recommendations are, all of these are of equal benefit in terms of reducing the risk of dying of colorectal cancer. So the U.S. Preventative Task Force has come out and told you that you can choose among all of these in terms of trying to prevent colon cancer. Now, I've been telling you this for a long time. If you look at my August 2010 newsletter, I've been telling you that you can reduce the risk of colorectal cancer. And my recommendations have been as thorough as doing a sigmoid exam with a barium enema, as practical as getting a sigmoid exam only at age 60, around age 60. I've also recommended fecal blood, and now this new Cologuard test intrigues me as a way of screening. But I've always recommended against colonoscopy because it has such great risks to it. We'll talk about that a little bit in a minute. But the first thing I want to tell you is that all this screening by any of these tests has never been shown to reduce overall mortality. Think about that. None of this, no, by the way, no screening test, PSA, mammography, breast self-examination, etc. No screening test has ever been shown to reduce overall mortality. In other words, make you live longer. What it does do is this test. Let's go back to the colon test. They reduce disease-specific mortality. In other words, your chance of dying of colon cancer. But you die of something else, maybe even the procedure. But the important thing for a screening test is to give you an overall chance of living longer and better. It's never been shown to do that. None of them. Mammography, PSA, any of the colorectal screening, none of them. They reduce disease-specific mortality. In other words, you're less likely to die of colon cancer. And all 7 of these tests show equal benefits. Let's just see some of the things that I noted, and you may want to read this JAMA Internal Medicine article, which was published June 15, 2016. It's titled Fecal Blood Testing or Colonoscopy. What is the best method for colon rectal cancer screening? Okay, it's copyrighted, so I can't show it all to you, but you can do what you want with it. All right, the U.S. Preventive Task Force declined, however, they told us to get the screening test, declined, however, to express a preference in screening methods, stating multiple screening strategies are available to choose from with different levels of evidence to support their effectiveness as well as unique advantages and limitations. Although there are no empirical data to demonstrate that any of the reviewed strategies provide a greater net benefit. Okay, so you have all 7 choices. Colonoscopy. There is no randomized clinical trial or other high-quality evidence showing that colonoscopy reduces colon rectal cancer mortality. In other words, colonoscopy is never, I told you none of the tests have been shown to reduce total mortality, but colonoscopy has never been shown to reduce death from colon cancer. Whereas some of the other tests have, like sigmoid with fecal occult blood, they have shown to reduce disease-specific colon rectal cancer death. Colonoscopy is not. But this is the big push. I mean, this is all you're offered. I have patients over several decades who have gone to their doctors and said, look, I want a sigmoid exam. And they refuse to do it. We don't do it. We don't do sigmoid exams. But they will in the future, I'll tell you that.
Yeah, that's what I've been told too.
Yeah, you can't have a sigmoid, which is a 2-foot tube.
Right.
We want the whole tube.
Right.
And they just won't do it. They won't do it at Kaiser. They won't do it at medical groups. You can't get the test that has been proven to reduce colorectal cancer mortality.
And it costs significantly less.
You don't have anesthesia.
Maybe that could be one.
Cost could have something to do with it. Anyway, this is going to change after these U.S. Preventive Services Task Force recommendations, particularly if you get them and you take them to the doctor and throw them down on the doctor's desk and say, excuse me, what gives here? I'm the consumer. Why can't I have the test that works and gives me less risk?
Right.
It makes no sense except for this is the way we always do things, and this is the way we pay for our colonoscopy lab.
Right.
And so, but anyway, it's right clear here. Sorry, let me just.
And I'm the doctor, and you're the patient who don't know anything.
Yeah.
And
take off your pants and lay down.
Right.
The American College of Gastroenterology refers to colonoscopy screening. They say colonoscopy over sigmoidoscopy include the reasons they do colonoscopy over sigmoidoscopy. This is what the American College of Gastroenterology says. The reason for colonoscopy over sigmoidoscopy include poor reimbursement.
Right.
Okay, poor reimbursement, poor patient satisfaction in the sense of physicians and patients, the visualization of one half of the colon with a sigmoidoscope may not be adequate.
Right.
That's what they think.
Mm-hmm.
In fact, they made statements that doing a colonoscopy over a sigmoid is like doing one breast exam.
Right.
But of course, we can go into all that too. Anyway, they go on and they say actual evidence that colonoscopy is better than sigmoid or fecal blood test screening is thin at best. And risk of colonoscopy are greater and increase with age. They say 4 perforations and 8 major bleeds per 10,000 colonoscopies. Anyway, you have to, the advantage of sigmoid is you don't have to have an anesthesia, you don't have to have as much preparation. When you administer heavy anesthesia, as a lot of people request, using propofol, which is, I believe, the drug that killed Michael Jackson. Mm-hmm. The risk of complications increases by 46%.
Right. There are other complications besides the colonoscopy.
16 to 22 per 10,000 of patients without polypectomy, without taking a polyp out. You had polyp, and the risk of complications, removing a polyp, increases to about 7% of people. Mm. And these can be as serious as as colon perforation, where today you're enjoying your kids and your job and everything. You're perfectly healthy. And a doctor comes in and says, you need to risk your life today for the theoretical possibility that you may reduce the risk of dying of colon cancer in 10, 20, 30 years, which, by the way, has never been shown. I just showed you. But that's what they're asking you to do, is to risk your life today for a benefit that has never been shown to occur. No reduction in colorectal cancer mortality has ever been shown with colonoscopies. No reduction in total mortality has ever been shown by any screening method. And yet they're asking you to risk your life today with a mammogram and a PSA test and even breast self-examination for screening tests that have never been shown to reduce overall mortality. I'm just about done with this. Colonoscopy is recommended to do once every 10 years. Of course, many of you are being told by your doctor to go in and have it done every year or every 2 or 3 years, whatever. But the overall recommendation is once every 10 years. I recommend never. Have I been clear? I recommended never. Now, that's for screening. You may have to have it done, if the fecal test comes back positive for blood, then you may have to have it done.
So there are, under no circumstances you would recommend colonoscopy.
Well, like, for example, if somebody had blood,
Right.
or they had some particular problem, yeah, I would recommend it.
Okay.
It's a good way to remove polyps, but we're talking about screening. We're taking and going out and capturing healthy people. Or It's called disease monitoring. You take millions of people who are healthy, enjoying their families and their life, and you ask them to undergo a test where, by the way, this will be important to you. Adenomas are common. These are the polyps.
Right.
Estimated to be present in 23 to 58% of asymptomatic average risk patients. In other words, it's just like the heart lesions I was telling you about over the last few weeks.
Right.
Ladies and gentlemen, if they look, they're going to find. Yeah, because they're there. So what do you expect? You're getting into the business. So weigh things carefully. Let me tell you again, 22 to 58% of asymptomatic average risk. That means you have polyps that they will find and they will treat, and you're in the business. All right, let's see. Just a couple of one-third of adenomas will regress with time. And I can show you studies that I got many, many years ago where people have familial polyposis. I mean, they have horrendous polyps throughout their colon. They're very at high risk of colon cancer. And through diversion colostomy, where they take them to stop the feces going through the colon, these polyps regressed. I can only imagine switching from the meat and dairy-based American diet to a clean flow of food through your colon would be as advantageous. They're not even talking about diet here, which is, one thing I won't leave out. Colon polyps and colon cancer are caused. What do you think? What do you think causes colon polyps and colon cancers? Could it be what you put in your colon? Any possibility? Like my friend Ernst Wender 30 years ago said, he went to the Sloan Kettering. He said he's a guy that discovered lung cancer and colon cancer and tobacco smoking. He said to the experts at Sloan Kettering, he says, cigarette smoking causes lung cancer. They said, nah, you gotta be kidding. And he says, no. He says, you take this tube of tobacco, and you suck it, and it causes lung cancer. And then he went back about 5 to 10 years later. Ernst Wender was a friend of mine. Very famous person in my day. Went back to Sloan Kettering and says, what you put in your colon causes colon cancer. And they said, nah, couldn't be. So anyways, these polyps regress.
It's genetic, right? Yeah.
Just bad luck, but it only occurs in people who eat the Western diet. There's no cult. Dennis Berger told me he's never saw colon cancer in Uganda. Over 17 years taking care of 10 million people, never saw a single case of it, nor were there any colon cancer in Japan prior to World War II or China and whatever. So anyway, we know now that removal of precancerous lesions is not beneficial in other types of cancers, such as prostate and breast cancer, possibly because the fast-growing cancers are the ones that are not detected with screening and are most likely to be dangerous. So, I mean, it doesn't work. It's a multi-billion-dollar business, whether they're looking at your breasts or your prostate or your colon. So 10 million cancers, 10 million Americans get colonoscopies each year. It's a $10 billion a year business. Okay, and then I go on, they talk about what H. Gilbert Welch is a friend of mine. You've seen him at our advanced study weekends, talks about, and that is that.
Who is that?
H. Gilbert Welch. He's a very famous guy. He spoke at 3 other advanced study weekends. Welch suggests that other causes such as diet with less nitrosamines and better treatments may explain decrease in mortality because they've occurred independent of screening. Most screening procedures, as in most screening procedures, none of the studies show a reduction in all-cause mortality. How many times have I said that? So there's no evidence to suggest that people live longer by participating in colon cancer screening, rectal screening programs. Interesting to know how many patients would undergo colonoscopies if they knew that there were no data to suggest that this procedure results in longer life. Although the U.S. Preventive Task Force did not make a recommendation about what method to use for colon cancer screening, an evidence-based review of the literature they assembled would favor either annual fecal blood with colonoscopy in cases in which blood was detected, or a one-time flexible sigmoidoscope, which is what I've been recommending to you for decades. And you can see it in my August 2010 newsletter and a follow-up newsletter. That's one sigmoid exam around age 60. Routine use of deep sedation with anesthesia services is unnecessary for most endoscopy procedures. And it goes on and on, but I've covered that enough. I hope I've made my point to you, as I have with heart disease over the last few weeks, that plain and simple, you're being cheated. These people are lying to you, except on occasion, like when the U.S. Preventive Service Task Force comes out, or on the heart disease data I gave you 3 weeks ago. There are a few truth tellers out there, but they quickly dismiss the truth as soon as possible because they're in business. They got to put shoes on their kids. They got to send their kids to college. I mean, that's what they're trained to do. It's fun. It's fun. It's fun. It's fun to pass these catheters. You get this catheter into the heart arteries, and you make little turns around to get in the right spot, and everybody applauds. This is great. Same thing with a colonoscopy. You lay down there, butt bare, and they stick this tube up your butt, and they got to get around all these curvatures, and the whole nursing staff and everybody's, this is fun. Oh, all right.
Okay, wow. That's not my idea of fun, but I guess.
Well, okay. You want to know the bottom line? I'm trying to tell you to get away from medical business. Understand the truths, the harms, the benefits. And the main way to get away from the medical business is to stay healthy. And the cause of these diseases, by and large, is the food you eat. And that's the basic McDougall message. But I'm also a board-certified internist. I have to care for my patients. And I'm not going to let them be abused, criminally abused by my colleagues if I have a choice.
Right.
If I can tell you, I did not go into this business to support the financial interests of your hospital or your doctors. And you can tell them I said so. Just don't tell them where I live.
But invite them on to the webinar.
Invite them to the webinar.
I can see a lot of your typing questions. Unfortunately, I'm too far away to be able to read it. I'm going to go with the questions that you've submitted. And remember that you can submit questions at webinar@drmcdougall.com, and then I'll get them. But if I have time, I'm going to get closer and look at those questions.
You do that, just they've already seen that.
Yeah.
This is a low-tech production.
So usually I'm at another computer so I can read the questions. But since you just talked about the Cologuard test, someone here asked, what would your recommendation be if a person gets a positive result?
Well, then you're in the business, and probably in your best interest. If you find blood in your stool or you have a positive Cologuard test, then you must go on to further examinations. But now it's no longer screening. You've already been screened and caught is probably the best word I can think of right now. You've been caught for your benefit. It may be well for your benefit. Don't let me kid you. There are some people who are helped, but it's no longer screening. Then now you go on to sigmoid exam or colonoscopy, and hopefully the doctor finds a colon cancer soon enough. I've had this at a personal level too, Gustavo. I had a very close friend of mine die of colon cancer.
Oh.
Yeah. Well, I talked to you about my friend who got colon cancer, and they threw him through the prophylactic revascularization and almost killed him. But I had another friend of mine this within the year who died of colon cancer. And I got a very scathing letter from her sister who said that if I would have not recommended against colonoscopy, she would be alive today. Well, that's not necessarily so, but I didn't continue the argument. Of course, the family was very, very upset with me because I've always recommended against colonoscopy. Well, excuse me, the U.S. Preventative Service, yeah, it's right here. They recommend against it too. Okay, it's not that I've never recommended screening as I have for my whole career. I've just recommended fecal blood and a sigmoid exam as is recommended here. Right. I feel bad that my friend died, and I feel bad that her family feels angry with me. But would I have made the same recommendations again? Well, for the general population, not knowing she was going to get colon cancer, absolutely. Yeah. If I knew she was going to get colon cancer, in retrospect, I can make better decisions. But I don't get that option.
You don't get that option.
No, so.
Right. What would you say if someone needs a surgery? This is tied to the newsletter from last month. This person says, what if I need a surgery and the doctor says that, I can't do the surgery until you have a stent put in because your test showed that you have blockages? Then what am a normal regular person gonna do?
What you need to do is you need to take my newsletter, May of 2016. You need to make a copy of it. You need to ask the doctor to read it. And of course, note that I have a tattoo on my chest that says "Do not cath. I will sue." You need to have the doctor read it and sit down with all the doctors. The one that's going to do your hip surgery or whatever, the cardiologist, whatever. You need to sit down and read this article together. I mean, even if you have to pay them an extra $500 to sit in the room with you,
it's worth it.
And then you say to them, "Is this true? Do you have any evidence to the contrary that treating chronic coronary artery disease saves lives? Do you have the evidence?" I mean, the American College of Cardiology, American Heart Association, told doctors to stop doing these procedures in 2007. If you have evidence to the contrary, please show it to me. And then you look the doctors in the eye, and by that time they'll say, "Okay, well, whatever you want to do, we'll make an exception for you. And let's go on to the next patient and see if we can fool them."
Next.
Yeah, next. But if they still look at you and they say that we won't do the surgery without doing a revascularization, man, I'd get out of it.
Go somewhere else.
Yeah, go somewhere else, or tell them, "All right, I'd like to meet you again tomorrow with my attorney so we can discuss this again." That always gets doctors' attentions. "Let's sit down with my attorney and have you sign a document that says this is the right thing to do based on the scientific evidence." And then,
the scientific evidence that you're going to provide me.
Well, I've already given you the scientific evidence that this is dangerous. This is criminally wrong to do this. So, if there's something I'm missing, I actually talked this week to some very, very powerful people in the cardiology business. I won't name any names, but I asked them, I said, "If I'm missing something, let me know so I can inform people." I said, I don't want to tell people something that's not true. Right. I don't want to open myself up for criticism other than you don't like me. I don't care about that. So, if there's anything I've said that's wrong or exaggerated, let me know. So if you're threatened with that, get a tattoo that says "Do not cath. I will sue." I don't know what to do. It's hard to stop these people.
Right.
I once thought that mastectomies would be something that was relegated to history and be shameful. But there are more mastectomies done today than there were 20 years ago. Unfortunately, the attitude in medicine, and it says so on one of these papers, is more is better. But really, less is better. And we know that. If you read JAMA Internal Medicine, they have an article almost every month called "Less is Better" when it comes to screening, treatment, and so on. So maybe your doctors are ignorant. And maybe you think that we're such high-tech and sophisticated in medicine that we've figured out how to save people. You better think again. You better reorient your attitude, because more is not better in any circumstance that I can think of except acute injuries, like acute infections. When it comes to chronic disease, more is harmful. And the publications I read, which are the best publications in the world, clearly say that. If your doctor is too busy to read the science, too uninterested to understand what's going on, get another doctor. Or as I say, don't go to the visit alone. Take your husband or your wife or your attorney and sit down and talk to them about it. Doctors love to talk to attorneys.
Oh, yes. Well, the patient is in a vulnerable position, and that's the advantage to the doctor that is trying to sell the procedure.
And you know what? The thing is, and what the doctors out there listening are saying, is we're ignorant about this. We're just ignorant. Well, excuse me, you went to school at least 7 years to learn how to take care of your customer. If you're ignorant, that's your problem. That's not anybody else's problem. You see how friendly I can be?
Right.
And I have students, like we had students the last program. We always get medical students and residents, and they come in and they are just absolutely shocked by the things that I tell them and show them in the research. And one of the students from the last program, he says, what you've taught me is to question everything. You should question everything.
Right.
Because each and every time we discuss a subject, such as rheumatoid arthritis or heart surgery or whatever, every time, and we just laid open the evidence. And these students are really good. I got these little devices.
Yeah.
And when I say something, bam, they're on there and they're seeing what the research says. Yeah. And so we get great discussions going. They said, I never knew that. Uh-huh. And one student, real good student we had last time says, you opened my eyes like Dennis Burkett opened my eyes, and Pritikin opened my eyes, and Kempner opened my eyes many years. He says, you've opened my eyes, and I will never, ever accept anything I'm told without questioning it. And
that is really the best advice. I mean, across any profession,
if I buy a car,
right?
If I buy a washing machine, why would you trust?
We do more research buying a car or washing machine than going to a doctor to have a chest open.
Yeah, I know. This is your life.
It's the life. Dr. McDougall, does a person with varicose veins have any hopes in improving that by following a better diet?
Well, varicose veins are caused by straining. You can relate to the straining of childbirth. But women who eat a healthy diet, like say they did in Uganda or in Japan or China 35 years ago, these women never had varicose veins, and they gave birth to 10 children. So you could relate to, many women say, well, I got varicose veins after I, pushed and shoved and so on to get this baby out. Well, that's a lot of pressure, back pressure on the veins in the legs, which stretch them. But what the real stretching is that causes varicose veins in men and women is chronic constipation. When you try and deliver that rock hard fecal marble every 3 to 15 days, that's how you get varicose veins and hiatal hernias and hemorrhoids, and prolapsed uterus by straining to move this rocky stool that you get when you eat the American diet. The question is there a chance for improvement? I wouldn't expect it. These are mechanical distortions of the veins. The valves are damaged in the veins. What hope you have is them not progressing. And also the hope you have is there are clinics out there that have laser treatments and sclerosing treatments that can treat some of the superficial veins for cosmetic issues. But boy, I'll tell you, the things that we used to do to people called vein stripping. Oh, unbelievably gross. I think about it. I used to be a surgical nurse, so I put myself through medical school. And we'd go in there with these long instruments, and we'd stick them through the ankle, up into the groin. And then we'd take this great big vein that was like this big in diameter, and we'd pull that sucker out through the ankle.
My God.
And so we used to strip veins. And then, of course, they didn't have any venous drainage. So they got edema. It was a horrible. I hope they don't do that anymore.
I hope so.
So you should leave the veins that are there so they can perform their function. And any superficial ones that are troubling you, you can try laser therapies that are all over your city, or maybe sclerosing with some sclerosing agent injected to them. But as you age, they're going to reappear. And if you continue eating the Western diet, they're going to accelerate even worse.
Right.
Yeah.
Right. You know, kind of going back to doctors again, a lot of people have the question, and actually I have someone that I know in my family that after following a better diet, their blood pressure came down considerably and it's normal all the time, but the doctor still refuses to take them off. So the question is that this person is saying, and I'm sure a lot of people have, should I just stop taking them myself, or what should I do?
You know, I can, of course, not being their doctor, can't advise them to do that. But I see this all the time. You know, patients come in. I've seen people come in back to their doctor having lost 60 pounds, dropping their blood pressure 100 points, having their chest pain go away, and say to the doctor, well, you know, I'm going to stop. I should be reducing or stopping my diabetic and blood pressure pills. And the doctor says, you can't do that. Well, the reason the doctor says you can't do that is because that's what the drug companies taught the doctor. That's what we learned is, I mean, it's only business, it's good business. You tell the patient they'll never get off our product. And so doctors are educated to believe that no patient can get off medication, which is absolutely the opposite. We get 90% of people, we've published it, 90% of people reduce or stop their blood pressure and high blood pressure and blood sugar pills and insulin often in type 2 diabetics. 90% of people. And if your doctor doesn't stop your medications, and say you're taking insulin and now your blood sugars are normal, you may get hypoglycemic, you may get an auto accident. You know, this is grounds for legal action against your physician to not act appropriately. And unfortunately, that's the only way that some of these doctors will listen. They won't, and it's changing, by the way. I really think doctors are kind of learning that there's a whole new world that they weren't taught and changing. So it's not everybody. But if the doctor looks you in the eye and says, you'll never get off your insulin, well, doctor, my blood sugar last night was 30. Or you'll never get off your blood pressure medication. But doctor, I stood up yesterday and I fell on my floor and hit my head. And I checked my blood pressure, it was like, you know, it's like 70/40. Now, this is dangerous to you for your doctor not to respond. And the reason your doctor doesn't respond is they've never seen a patient get better before. It's never happened.
Right.
So they don't think it could ever happen. Never taught in medical school how to treat people with dietary therapy. And I know that for sure. After all, remember, I was central in the passage of SB 380, which is a law signed by Governor Jerry Brown of California, which forces the 11 medical schools in California to teach nutrition to their students and forces doctors in California to learn about human nutrition. Yet they beat me because I just got tired of fighting them. I mean, somebody else can take over. They beat me by turning the implementation of this law over to the California Medical Board. And the way they've implemented this law is they put a paragraph in their newsletter once a year that talks about nutrition to doctors. That's how they implemented the law.
That's how it
yeah. And you know what? I'm just tired.
Right.
I'm one person. I'm tired. I'll leave it for some other attorneys or some patients or some doctors to take it up and say, we're hurting California. I actually testified to the California Medical Board, which is a very dangerous thing to do, by the way, because they have law and order over my practice license. Right. But I actually testified them. And it's a meeting you can get on Google. Yes, I had 120 seconds to talk to them before they finally decided to put one paragraph in their newsletter. And I talked to them about how since Governor Jerry Brown signed the law in September 2011, until the hearing, which was probably a year and a half later, how 1 million children have become obese and stayed obese, and they've spent this many $1 billion on unnecessary heart surgery and diabetic treatment. Because I didn't think they would pay attention to the human aspect of it, of saving people's lives. So I hit them with the economic aspect. I told them how much the state of California has lost financially by delay in implementing the law SB 80s, which is law in California. You ought to get it done in your states. You ought to get it done in your country. You ought to go to the government and say, there ought to be a law that physicians know what human beings eat. Right. Just like veterinarians ought to know what animals eat. Right. Anyway, it's there. Anybody that wants to run with it can. I'm done.
Yes. Well, there's so much you can do, and there's so many things that you want to do.
Yeah, I could dedicate my life to that. It's been that way all along. I've had to make choices. You know, who do I want to fight? Because there are lots of people that fight.
Right. And this could be, like you said, it could take your life.
Yeah.
And you don't.
I could spend the next 2 or 3 years going after various heart organizations for failing to protect patients.
Right.
And going after individual cardiologists or individual gastroenterologists. I could spend the rest of my life doing it. I'm not going to do it. I've given you the information. I've gotten basic laws passed. I need some help. You know, if you guys and gals want the world to change better for your children and grandchildren to protect yourselves,
we all need to pitch in. Yeah,
you got to help.
I'm going to read some of the questions that are coming up. In the meantime, would you address this question that has come up a few times and I just hadn't had the time to ask it? Someone that is asking about thyroid cancer and want to cut it out. And is there anything else they can do besides not eating meat?
Well, once you're diagnosed, you're kind of stuck is the problem.
Right.
Screening for thyroid cancer is very common in Korea. And they find, millions, I don't know, tens of thousands of people with thyroid cancer. If you look, you find. But it is inappropriate screening in the US to look for thyroid cancer. And the treatment of thyroid cancer in terms of success, the screening and treatment is extremely questionable. And I'd have to say, without reviewing the literature, which I haven't done in a while, but you can see H. Gilbert Welch has written about this, about thyroid cancer screening. He's the man I talked to you about a few minutes ago, who's been at our advanced study weekend on 3 occasions. I would say that Gilbert Welch is a friend of mine. I don't know what he'd say, but I think he'd probably say too. He's written on screening for thyroid cancer, and so go out and read about it. Go to PubMed and see what the benefits are in terms of removing your thyroid. I think that's about as far as I could comment without myself taking the trouble to see what the literature actually says. But I'm sure you'll find that the benefits are far less than you've been told, and the risks are far greater than you're told in terms of looking for thyroid cancer and in terms of treating it once you found it.
Right. What do you recommend for someone who has an underactive thyroid? What kind of medication?
Well, I give levothyroxine. Always have. I do it. Probably I write a prescription for it every program, maybe 1, 2, 3 times. Why do I give levothyroxine? It's because that's where I was trained 40 years ago, 50 years ago, almost 50 years ago. And the reason I don't give Armour or other natural thyroids is these are glandular extracts. They come from pigs and cows. Well, there's an ethical issue involved, but there's also the problem of transferring microbes. These cows and pigs are sick with viruses and mad cow prions and other organisms that when you eat this Armour natural thyroid stuff, you're eating cow glands. If you just take it, and I've had some of my patients do this, you just take and open the bottle and sniff. You'll see what I mean. It really stinks. There's also been some talk about how these natural thyroid preparations are unreliable in the dosage.
Consistent.
Not consistent, yeah. But I have people come in, you can imagine, lots of people I take care of are quote into the natural movement. And they insist on continuing the natural thyroid. I don't put up a big stink about it, but I tell them what I just told you is that, levothyroxine, that's the way I was trained. It's really cheap. You can get 90 pills at Walmart for $10. You're not taking in animal microbes. You're not contributing to the profits of the animal butchering business. So
right. Can someone that has been taken Synthroid or any other can they ever get off of it?
No, I don't think so. Not if you really need it. See what that is? That's a reflection of a destroyed thyroid gland.
Right.
So you don't have thyroid tissue. And I'll just take a second, more than Gustavo would like me to do, but I'll just take a second. You say, well, why? About 40% of women in the 40-year-old age group have thyroid problems. And you say, well, why is this? Well, you ask your doctor, why do I have thyroid trouble? Your doctor would say you have autoimmune thyroiditis. Women are more likely to get all kinds of autoimmune diseases. Why? I wouldn't even want to comment on. So why do you get autoimmune thyroiditis? Well, you get autoimmune diseases like rheumatoid arthritis, lupus, nephritis, that means kidney disease, nephrotic syndrome. This happens when foreign proteins get into your system. Now, these foreign proteins could be viruses, but more often they're animal foods like type 1 diabetes. I believe has clearly been shown to be caused in the vast majority of people by consuming cow's milk protein, particularly in young. In fact, the American Academy of Pediatrics made a statement in 1994, and after one of their committee meetings, that children should avoid cow's milk before the age of 1 because it is linked to type 1 diabetes. Of course, I'm saying it's stronger than that. So somehow, some animal protein, like, for example, they reported 4 cases of nephrotic syndrome in the New England Journal of Medicine. I believe it was 2011. And they did immunofluorescent studies of the kidneys and found that there was cow protein, antibodies to cow protein attacking the kidneys. And they took the kids off the milk, and all 4 cases cleared up. This was published in the New England Journal of Medicine with photographs. So an animal protein gets into the body. The body appreciates that animal protein as being foreign. It's cow or pig or beef. So it makes antibodies against that foreign protein, but in the process, it also makes antibodies to our own tissues. It's called molecular mimicry. So I'm going to finish this up, Gustavo. Here's the question. How do we get exposed to foreign thyroid glands so that we make antibodies that will attack our own thyroid? How's that happen? How do people eat foreign thyroid glands? Mm-hmm. It's called hot dogs and sausage. They don't waste anything in the slaughterhouse. So you eat these foreign pig and cow glands, and your body recognizes these proteins as foreign. This is what I believe. I can't give you any evidence on the thyroid specifically. It makes antibodies to the pig and cow thyroid, and it looks for similar tissue, and it finds your own thyroid gland and attacks it and kills it. That's my best guess. Right. I kind of made that story up for you.
Okay, well, it's very credible. There's something very interesting happened to me when I came to the 10-day program 3 years ago. My thyroid was under work, was hypo. Yeah. And you recommended medicine. Legal thyroid. I waited though a few months. I had a test, and now 3 years later, it's normal. Yeah. But that's not very common, is it?
Actually, if I was to analyze our data on 1,615 people that we published in terms of weight and cholesterol and so on, we published that in October 2014. I have that data, and if I analyzed it for TSH changes, my guess would be in 7 days, we get an average of about 1 microinternational unit improvement, 0.8. Mm-hmm. Just in 7 days with diet. But I've never analyzed it. I've never had an interest in publishing it, but the data is available. So yes, I would say I see, which I never talk about, and I shouldn't be talking about now. Right. I see on average about almost a 1 point improvement in TSH. And we always check if somebody's abnormal the first time. We always check the second time. As I'm sure we did with you, to make sure it wasn't a lab error. And we see, like in the last program, we saw somebody go from over 6, and normal is 2, down to about 2.5. Right. Yeah. Microinternational units. So you do see changes, and you wouldn't embarrass me at all if you came and told me that the diet we teach dramatically improves thyroid function, in one way or the other, either because it allows thyroid to work better, or the body. I don't know why. Yeah. But I wouldn't count on it. Yes, I wouldn't. And I wouldn't plan on getting off levothyroxine. Maybe have have it tested. Would you recommend? Well, the way you would do it is this: if you were on levothyroxine, you talk to your doctor, and you'd say, "Look, I don't think I need to be on this thyroid medication because I was put on it because I was too fat and too tired, not for appropriate reasons, or whatever." So you say to the doctor, I would like to be off it. I think I can be off of it. And the doctor should respond to you. Okay, you're taking no risks stopping it as long as you recheck your TSH level in about 3 to 6 weeks. Because if your thyroid gland isn't working, the thyroid medication you're taking lasts about 3 weeks in the body.
Right.
So you have to wait that long to see whether or not your own gland takes over. And I want to tell you, if your gland doesn't take over and you don't address it, you're in big trouble.
Right.
You must take this supplementation if you need it.
Right.
But that's the way you do it. And you get your doctor's cooperation, get the lab test set up, be sure to recheck, and do treat if you need it.
All right. Very good. Let's see. Maybe 1 or 2 more questions. It's already noon. So
Okay. We don't want to bore them.
we don't want to bore you. So there's quite a large group of people on Facebook that follow you, about several actually.
Actually, I heard we have 120,000 likes.
Yes, plus I know that's a large number.
Yeah, I know so little about Facebook. Fortunately, I do get to
Well, don't bother with it.
Yeah, really.
So a lot of the people have seen on the internet somewhere. I haven't seen it. A video of you saying that way back, saying that there were in your life special occasions where you would have a little piece of cake for a birthday, or a tiny slice of turkey for a Thanksgiving.
Yeah.
So
let me address that. Actually,
say
about 2 or 3 weeks ago, we talked about this on the internet. You asked when my birthday.
I know.
You asked if I had a piece of cake,
Yes.
and I told you yes, I did.
So there is one of the webinars, not like 2 or 3 weeks ago, where you
It was
mentioned
about
that.
my birthday around May 17th.
So, but people get confused, and they're starting to.
All right. Well, first of all, I'm nearly 70 years old, and I'm in very good health. The human body is amazing, and I've tested it. It can tolerate 2 packs of cigarettes a day, a half a bottle of whiskey a day, and I've tested it, and it can live on hot dogs and butter and bologna sandwich. I have tested it.
You have done the research.
I almost died doing it back before I was 30.
For the good of humanity.
Well, out of ignorance. Well, anyway, so we have, let's see, I have 7 grandkids. I have 3 kids, so that's 10. And there's Mary and I, so we have 10 birthdays a year.
Right.
And we all, unfortunately, we all get together. Yeah. And as I told you last time, we'll typically order a cake that's like this big.
Right.
Small, real chocolate
Very
cake.
small.
Very chocolate cake. And half of it will be consumed by the entire 10 of us.
Right.
And then if you look at their plates, half of the cake is left behind. Because nobody in the family is really used to it. So yeah, we do that. And then I have joked, the reason I've joked is for your benefit. But you won't never know if it's true or not. But ever since I've been doing this, I've tried to distance myself from the vegan concept.
Right.
Because the first vegan I knew, actually I was still alive and well, it was one of my interns when I was a resident. So you know how long ago that was. It was in the early 70s. He was vegan because of animal issues, animal rights issues, what I didn't understand back then. He would wear plastic shoes. And
right. There are other things that vegan.
But he was very overweight and very greasy and very sickly. And his diet was Cokes and potato chips. And there are lots of unhealthy vegans out there. So I've always tried to at least give myself a little breathing room from the vegan concept, even though for all practical purposes, all of our family is near vegan or vegan. You need to know that. So one of the ways I did this, and I have been booed at vegetarian conferences, is I tell people that every other Thanksgiving, I eat a piece of turkey about this big. Okay, I tell them that. Now, I never tell them which Thanksgiving it is. And they don't know whether it's really true or not.
Right.
But I can tell you that my animal food intake is about that much or less every other year. So if the turkey and I have to sacrifice to get the proper message across to you, we have agreed to do it.
You have agreed.
Yeah. I want you to understand this is a starch-based diet with the addition of fruits and vegetables. If you are in good health, you can afford an occasional delicacy, but I'm not going to choose that for you.
Right.
And likewise, what I do is pretty much my business.
Mm-hmm.
If I decide, I hope I never decide to start smoking again.
No.
I quit that in 1972. But I mean, if I make a personal decision well informed, that should be up to me. I'm over 21. I'm a free citizen. If you make decisions well informed, I would never criticize you. But I'd be very upset if I didn't give you the right information or somehow you failed to understand it. So the reason that I've said these things, particularly the thing about the cruelty to the turkey, which I do understand if you're mad at me. I smile. I shouldn't smile. I really do understand.
Yeah.
The turkey and I do this so that you get the proper concept. That is, you're supposed to be eating a diet of rice, potatoes, corn, sweet potatoes, some green and yellow vegetables, some fruits. And, if you happen to decide to eat your cat or your dog or your horse or whatever, go for it.
Well,
that's pretty gross.
Great answer, yes. Very good answer.
And you're thinking about coming to Kauai.
Yes, I'm seriously thinking.
It's in January.
Yes.
And Mary has, this is her third time she's sold out. She's got a few rooms left, and I'm not joking you. She's going to tell you at the end of this month that the price of the trip goes up $200.
Right.
Because that's the early discount's done. It's done at the end of June. And she's going to tell you sometime in July or August that she can't get any more rooms.
Mm-hmm. Yeah, there's a limit.
That basically the hotel
and
is
you will never know if there is a tattoo here.
Yeah, until you go to Kauai. You'll never see my tattoo until you go to Kauai. So if you want to go with us on a trip, actually, anyway, it doesn't matter. But Kauai is an amazing experience, Kauai Sheraton. So we'd like to have you go. And then we're going to ask you sometime in the future, near future, whether or not you would like to go take this very high-end trip. It's not going to be inexpensive, to down the coast of Costa Rica and through the Panama Canal with us. And I believe we are going to be able to take 80 people, and that's it.
Mm-hmm.
And so Mary's going to put out an announcement to see whether or not, maybe it's 100.
Right.
But whether or not there's enough interest for us to buy the ship. If we buy the ship, it costs us just to, put down the deposit. It costs us, well more than $100,000. I can't afford to lose that.
No.
So we need to know that you're interested. I don't know. Mary's going to probably come out here and say it's a lot more than $100,000.
There's a lot more than that. Well,
but anyway, we planned that trip, and then I don't know what else we're going to do again.
Right.
Well, we thought about an inexpensive trip down one of the rivers on the East Coast,
mm-hmm.
and an inexpensive trip on one of the ships down the Columbia River. But don't count on it.
Yeah.
Mary and I have taken people. We've taken thousands of people around the North and South Hemisphere, Central America, over the last 25, 30 years. There's going to be a limit as to what we want to do and are going to do. The main driver right now is we started these trips because we were dirt poor and we couldn't afford to show our parents or our children any of the world. So we figured out if we could take other people on trips, we could at least get our passage paid. And then it became a business. And now we really, the business is a lot of work for Mary. Remember, she's 70 and she basically hits the whole thing. But now we have another driving force because we got all these grandkids we want to show the world to too.
Exactly.
So Heather's kind of deciding, our daughter who runs all the companies,
yes.
She's deciding what she wants to show her children.
Mm-hmm.
So it kind of depends on what Heather wants to show her kids as to whether we're going anyplace.
Oh, wonderful.
Otherwise, we got an advanced study weekend.
Yes.
And I'm going to announce that. I've already got it. It's going to be really special. We're around time because I'll talk about it when I get back in 2 weeks. But we really want to sign up for the advanced study weekend. It will be a sellout.
Oh, yes. It's
T. Colin Campbell will be there. We have many other really important guests.
It's a treat.
It's
amazing.
And then we're going to do, I guess we have one more.
You have one more 10 day in August. Right.
And we run several of them from different businesses. So it's not like we're going to be sitting around.
Right. Oh, no, you're busy all the time.
Yeah, we're busy all
the time. Well,
anyway.
Thank you. And remember to join me and Dr. Doug Lyle next week while we give a rest to Dr. McDougall here while you're in Alaska.
I'll be missing you.
Yeah. Well, I'll be missing you too.
All right. And thank you, so.
Thank you. It was wonderful to do these 2 webinars here with you at your home.
Maybe we'll do one from Hawaii together.
Right. Exactly. Yes.
All right.
Okay. Goodbye, everybody.